snap-in denture is also a term that's out there, and it refers to the implants that you take in and out at night, and we would encourage that on the denture or the implant stabilized denture, where you would pop it out. It gives that soft tissue time to rebound overnight, and then you place the implant back in the morning. Is that a requirement? Not necessarily, other than we do like you to clean underneath the denture periodically, and it literally just pops back in, slides back over the O-rings. We find that a lot of our female patients will tend to wear their dentures 24/7, and that's fine too.